Hello, everyone. This is Ashwini with you, and thank you so much for all of you for waiting patiently. I hope the audio and video is clear. If you have any issues, if the audio, video, if anything is not clear, please leave a message in the chat box. The technical team will look into it. If it's all fine, just give me a thumbs up, please. Okay, thank you. So, as all of you who are here are aware that today this session is on medical PG pathway for international medical graduates to work in Australia. So, one second, please. Okay, thank you. So, this is on medical PG pathway for doctors to work or study in Australia. So, our guest for today is Dr. Krishnapriya Balanarayanan. A very warm welcome to you, Doctor, and many thanks for taking time out of your busy schedule to be here today.
Oh, thank you for having me.
Thank you so much. So, before we go ahead with the session, it's a request to all of you. Please help us to understand you a bit more on screen. I request all of you to please select the right option that's relevant for you. So, the first poll question is we would like to know No. So we would like to know about your medical school status. Like, are you still in the medical school? Are you in your internship? Or have you completed your medical school and internship? Are you working now? This is just to understand the audience today, how young the audience is. Are you all still in the graduation or completed graduation? Okay, nice. So we have majority of doctors attending the session today have completed MBBS and internship. Very nice. Thank you. We have one more question coming up. Again, this is understand you a bit more better. You can close this. Put up the next question. This is for us to know, have you decided it is Australia for you? Like you've already, done this clarity that yes, I am going to go to Australia for my medical PG and I want Dr. Bala to please help us explain us with all the details. Or most of you are still undecided, like you're still thinking or you're not sure whether you want to do it in Australia, India, UK, US, maybe you're still not sure. If you can just click the right relevant answer.
I think I know where the majority is going for this question.
Did answer. Okay, but not bad. Okay, majority is still undecided, but quite a large number of, I think, pool attending the session today, they are very clear that it is Australia.
Yeah.
Nice that you've done your homework and you actually have the mind of doing PhD in Australia. So we have just one last poll question coming up. Request your answers for this as well. Now, because you all are exploring international career options, I want to know what is the major challenge you see in your journey? Is it that you do not have a proper mentor, right connections, right network to help you throughout this journey? Or passing the entrance exam itself is quite challenging for you and that scares you? Or uncertainty in matching to a particular residency kind of is the biggest challenge that you face in your journey? Or working in a different country, adjusting to the new system is a kind of fear that you have. Okay, very nice. So majority of you have answered that you do not have right connections or right guidance or right mentor to help you in your journey. That's the biggest challenge you're facing as of today. So we understand this is the major concern. This is a major concern you have. And most of the doctors that we've come across have actually told us this, that, that they do not have right connections, or let's say the supportive network who will encourage them, on who will guide them, help them, handle them in their journey. So here we are with a solution. So we've come up with Inspire IMG. So we've launched, 1 second, please. There's a technical issue. Just give me a second, please. I'm really sorry, it never happens, but I think today there's a little bit of lag from my side. Is it fine now, Dr. Bala? Is the audio okay?
It's a little better. You do lag sometimes, but it's better.
Okay, okay. So we understand this is a major concern, and you face many challenges in this journey, starting from your decision making process. And here we are with a solution, Inspire IMG. Inspire IMG is a social networking platform which connects you with the successful physicians, surgeons on the other side. This platform is not limited to one single country or one single pathway. Rather, you will have an opportunity to interact live with different doctors from different countries. It's a great place to network and receive credible information regarding study, work opportunities, and maybe get the right guidance, mentorship from doctors in UK, US, Australia, Canada, wherever you are, or whichever country you are exploring. So we have many events coming up, or we have many events lined up for you. Just 2 to 3 days back, we finished an event where a program director from USA spoke about maximizing the chances of IMGs to match to residency in the US. So gradually, after this event, in next couple of days, we have doctor from Canada talking about IMG pathway in Canada. Then we have doctors from UK, New Zealand, and a doctor from Switzerland coming up and talking about opportunities for doctors in other countries. So please join Inspire IMG. Do follow us on Instagram and become member today if you want to be updated on all the future events that's coming up on Inspire IMG platform. The joining link, the website, everything will be shared with you during the end of this session. So this is about Inspire IMG. So now starting with our session. So again, a very warm welcome to you, Dr. Bala. So Dr. Bala has taken out, it was really difficult to actually get her time today, but thank you so much. We were receiving many requests because as most of you know, Inspire IMG is powered by Go Campus. So because Go Campus assists doctors only for India, UK, US, but constantly we receive calls, emails where they ask us, how about Australia? Like even our doctors who are working in UK, they ask us, what are the opportunities that we have in Australia? Can we move to Australia after a year, after 2 years? And she is from India, she is from Manipal. So who else can connect with you better than Dr. Bala? So here she is. Whatever doubts, whatever queries, whatever concerns you have as she starts this session, don't keep it with you till the end of the session. Start putting it in Q&A. We will take up all the questions in the end of the session once Dr. Bala is done with her talk. Should that be okay, Dr. Bala? Because I might forget again. When you're talking, I think they can put a question in Q&A, but we will ask you those questions in the end of the session.
No, that's the best way. That works well for me. Thank you.
Sure. Thank you. So over to you now.
Hi guys, thanks for having me today. It's a pleasure to be here and to talk about the Australian system. A little bit about me. I am an international medical graduate. I did my medicine in Australia. In Manipal University in Karnataka. Then I got married and moved here. And once I did that, I did my MCQ exam, my clinical exam, and I started working here. Now, I'm currently working as an emergency medicine registrar, and I am also a fellow in the fellowship pathway to become a general practitioner. I thought, when Ashni approached me regarding having a talk, I said, what better way to get in connection with all you guys and kind of help you through your journey. So I have a little bit of a presentation that will help us during the talk. And if you have any questions, just put in the Q&A, and I'm more than happy to chat to you guys about what are the options available. So just 1 second. Is everyone able to see my PowerPoint slide? Yes. I'm gonna take that as a yes and start, if that's all right. So today what I'll be talking about is going to be about a medical pathway in Australia, and my name is Krishnapriya Balanarayanan, but you can refer to me as KP Balan. So I did my medicine, like I said, in Manipal, and then I did the AMCs, and I've also done a certification in emergency medicine. So that's my area of interest. So to get started, why Australia? So, well, it's a very good question because you can pretty much travel anywhere. Anywhere you go in medicine, you know that you have to do the exams. So why Australia? Well, you have good pay, good hours. Your hours are protected. You have a AMA, which is a union for doctors that makes sure that you're only allocated a certain number of hours in your fortnight. You have access to a wide range of fellowships, which we will be touching base in our slides that's yet to come. And currently we have jobs available. When I first started, even after finishing your clinical exam, it was pretty much not possible to get a job right away unless you knew someone. And that's how I got my job through a Manipal alumni helping me out through the process. But now we are in a situation with the pandemic and everything that we are short-staffed, and we do get Irish doctors to come in and help us. So it is a good time to come to Australia. So moving on, because the panel in our questionnaires did say that most of you guys have just finished your medical degree, and a lot of you guys are in internship, and also students that have just completed your internship as well. I thought we'll just touch base very quickly about what is the registration process, and I've received a lot of questions on this. So first and foremost, go make an account in the AMC. You need an AMC ID to do anything. And also you have to check if your college that you did your medicine or your specialty training in the World Directory of Medical registry. All right. If your college is there, then you can proceed forward. If your college is not there, then unfortunately you won't be able to proceed forward to work in Australia. Once that's done, you register with the AMC portal, and you do your primary verifications and get your certification qualified. And that's when you get your AMC ID. Once your AMC ID is received, you will have to do a third-party verification called the EPIC verification. And again, everything is straightforward. They will guide you next step by step. The only thing that I want you guys to remember is that each step you will be asked to pay a certain fee. It is not a lump sum amount that you pay at the beginning. Each step requires you to make a payment. Once everything is done, all the paperwork is done, then you're set for your MCQ exams, basically. So you have two sets of exams. You have your MCQ exam and your clinical exam. MCQ exam can be done in your home country if they have centers for it. Clinical exam, unfortunately, they're moving into back to face-to-face exams. So they're only held in Australia. And in Australia, they're only held in Melbourne at the moment. Once you've completed your exams, you basically can get registered and start working. All right. So we're going to go into a bit more details about that because it can be a bit more confusing about when we get to that stage. So Once you've completed your registration, you're ready to do the exams, you have a couple of pathways. You have a standard pathway, the competent pathway, and the specialist pathway. Now, standard pathway is where majority of you guys are going to fall into. The competent pathway is limited to 5 countries, including US, Canada, Ireland, UK, and New Zealand. These are the countries that can come to the competent pathway. And I'll touch base with the competent pathway in a bit. But before that, let's look at the standard pathway. So standard pathway is where you have 2 options to come to the standard pathway. So one is where you finish the MCQ, then you give your clinical exam, and you can apply for the registration once you have passed both exams. Now, say that you're not really keen in doing the clinical exam and you feel that it's very tough or you're burnt out, whatever the reason may be. What you can do is once you've completed your MCQ exam, you can go for a work-based assessment. Now, I will elaborate a bit more on the work-based assessment. So, and if you guys have any further questions, I'm more than happy to answer that later in the Q&A. So now going back to the competent pathway is only for the candidates that have gone and gotten a registration in those other 5 countries, and when I say that, I mean, they must have passed their part 1 and part 2 of their exams in UK, for example, PLAB 1 and PLAB 2, and they must have completed a 1 year of rotation in the country, in one of those 5 countries. Only after that can they come to Australia through the competent pathway and get a provisional registration to practice here. All right. Now, when I say provisional registration, I will elaborate a bit more in the later stages. But provisional registration is similar to supervised rotations that you'll have to go through. Okay. Now, there is a group of candidates that are attending today that will be that is curious about the specialist pathway, and the specialist pathway can get a bit confusing. So I'm going to allocate that till the end of the presentation. So here's a flow chart. Now, this is all from the AHPRA website, which is the official website. As you can see, they give you a very good flow chart as to which pathway you'll fall into. So if you've had a specialist qualification, then you can attempt for the specialist pathway. But if you don't, then you are subjected to either the standard pathway or the competent pathway. So exams, what are the exams? So for the MCQ exam, you have the 2 main books, which is the handbook for the MCQs and the annotated multiple choice questions book. Apart from this, about 80% of your questions are from recalls. So that means it does take a huge part from you guys to go onto Facebook and actually join groups where the past candidates post their recalls up on the website. This is very crucial because 80% of your questions come from these feedbacks. All right. And however, when you do think of the recalls and when you go through the recalls, please make sure that you go through the Australian guidelines and you know the answer yourself and you know the topic well and truly well. Because what happens is, I don't know about you guys, but when I go for an exam and when I come back from the exam, I remember the topics, but I don't remember the questions exactly how it is. So for me, I will take the recalls with a pinch of salt and actually do my homework as to find out what the answers are. And apart from that, the clinical exam is a second part of the exam. That's where I come in. I tutor and I teach students for the clinical exam. Clinical exam mainly follows the AMC Handbook of Clinical Assessments. Now, that's the holy Bible of the book, and you just have to know the cases in and out. And that's, again, where the cases come out of that book for your clinical exam. Now, apart from that, you also, again, have recalls for this station. So for this exam, again, you got to get into the Facebook page and actually get the recalls month by month for the recalls and actually go through them and role play them with your partners. All right. Now, with both of them, there is another textbook called the John Murtaugh textbook, and I'm pretty sure most of you guys have heard about the textbook. He's actually a clinical examiner at one of these stations that he comes for. His book, you do not need to read it back to back. You just need to use it for a reference, and always use your Australian guidelines for your exams for reference purposes. But again, you don't need to read anything back to back. So again, there's very good flow chart that is given by the AHPRA again, that tells you how the process is. So once you've completed the AMC MCQ, you actually go for the clinical, you secure an employment, and then you get your provisional registration and you do the 12 months supervised practice. But say that you were able to secure an employment after your MCQs, you do have a special registration called the limited registration that allows you to practice and study, but you eventually have to do the AMC clinical exam, or you'll have to do the work-based assessment. And I'll touch base with that in a bit. So what is limited registration? So it is a registration that is provided if you're able to secure a job after your MCQ exam, and you have to renew it every 1 year, and you can renew it up to 3 years. Once these 3 years are done, what happens is you have to do a whole new process to get it reassessed and see if you can again apply for the limited registration. So there is a time limit as how many times you can renew this and how many times you can continue to work in Australia with this registration. The other big downside to limited registration is that you cannot enter any of the fellowships. You cannot enter any of the advanced training with this registration. You have to have a general registration to enter any of the types of training that you want to join. All right. Now, you can get limited registration in 4 basic categories. And out of that, I've highlighted 2 of them, which is the area of need and the postgraduate training and supervised practice. This is where majority of you guys will fall. The other 2, which is teaching or research, which is basically for candidates that are not looking to go into clinical and just want to do research, you guys can go into that category. The other one is a public interest category. Now, this is actually not decided by any of the health bodies. It's actually decided by the state and the territories, where they decide, hey, yes, there is a public interest. Yes, we are short of staff, so we need more doctors to come in. The thing about this is that it has to be registered as, yes, this is a pandemic like the COVID, and also that there's a natural disaster. The other thing about this type of registration, if you fall under this category, is that the maximum duration that you usually get is about 4 to 8 weeks. You usually don't get longer than that. And if you do, then you have to submit more paperwork as to why you need it longer, which is trust me, it's a whole lot of paperwork. So talking about area of need is basically where it's usually rural areas where they deem that they're short of staff and that they need more doctors there. So they do allow doctors who want to get into the workforce right away to go and apply for the area of need limited registration and start working. The other postgraduate training and the supervised training, supervised practice registration, something that they have come and kind of broadened a little bit, where say you want to still prepare for your AMC exams, but you also want to work to be financially stable and also support your family, you apply for this registration. Basically, you apply for this, so you go to work and you come back and you can also study for your exam, but you have to show that at the end of the day, you are working towards giving the AMC clinical exam. The other one is that if you're working, say, for example, say that you were able to secure a job at a work-based assessment site, then you have to apply for the limited registration for postgraduate training for you to continue with the work-based assessment. And I'll get into that in a little bit. So notice that work-based assessments, you can skip the whole provisional registration. So that is the bonus about work-based assessment. And I'll get to that in a bit. So what is provisional registration? Provisional registration is a registration that is given once you've done your MCQs and your clinicals. You go and secure a job in a hospital. The hospital will apply to AHPRA for your provisional registration. And that is where you have to do 1 year of rotation and it's a supervised rotation. They review your application and see what level of supervision you require. And it is categorized in PGY 1 or 2, as a PGY 1 or 2. All right. Now, when I say PGY, it's basically postgraduate years. That's what they define it as. So once you get your provisional registration, you can start working, and you need to have a minimum of 10 weeks in general medicine and 10 weeks in surgery and 8 weeks in ED for you to qualify for a general registration at the end of your provisional registration. And that these are mandatory rotations that you must complete. Okay. And there's one more term that will fall into that category, and that is your choice or the hospital's choice. Usually they give you a leave relief term. And And frankly, leave relief term is a good term to have because you can actually go into other departments in that hospital and kind of realize how they work and what is the patient demographic that you get to see. Apart from that, one thing a lot of candidates don't pay attention is that when they get the provisional registration, they don't realize that the annual leave and sick leave does not get counted. So if you take a 5-week holiday and you only have 46 weeks of full-time service, you do not get your provisional general registration. So please make sure that you do the calculations right before you take your annual and sick leave. So moving on to general registration. Now, this is the ultimate goal that you need. Once you have your general registration, which is after the provisional registration, which you automatically get if you have satisfied those criteria, you can actually apply for a fellowship training, provided that you have a permanent resident status or a citizenship status for most of the training. All right. So we'll get into that a little bit. So general registration is usually for candidates who have done the MCQ and the clinical, they get and done the provisional registration, and then they get their general. Otherwise, candidates who have done their work-based assessment skip altogether their provisional registration and jump straight into the general registration when they're done with that 1 year of supervised training. Now, what is work-based assessment? So work-based assessment is basically a year-long process where you will be paying a fee to enter the program. And 6 months of the first 6 months of the program will be internal assessments at an accredited site. And the second half of the 6 months will be an external assessment at the accredited site. And once that is done, you will be provided with the general registration if you have passed all the assessments. So you're completely skipping the provisional registration phase. All right. So this is a flow chart that they've given to simplify it further. Basically, see if you're gotten an employment or a job offer at an AMC accredited hospital. Okay. If you haven't, get one first. After that, you express interest saying that, hey, I would like to get into the work-based assessment program. They put it through to the AMC. The hospital presents it to the AMC. The AMC checks your eligibility and approves it. Once they've approved it, you do the entire process of work-based assessment and you submit the assessments again for approval. If you've successfully passed all the assessments, you straight away get your general registration. All right, I hope I've made it easy and clear for you guys there. So work-based assessments are not in every hospital. They have to be accredited for this. So these are a couple of hospitals that are accredited in each of the states that I've provided. And there are a lot more, and you can find that in that website. And again, this is just a small snapshot of all the places, again, hospitals that provide the work-based assessment in other states. So let's go to specialization. So once you've got your general registration, which is mandatory for any specialization, you can enter the training phase. So as you can see, you can enter adult and pediatric medicine, ED, surgery, and general practice. Now, just to give you just a heads up, make whatever year or whenever you guys do decide to come in and whenever you guys do get your general registration and decide to join the specialization, please make sure you check on the eligibility criteria because they do change quite often. All right. Now, I personally know a lot about the general practice and ED training because that's the two areas that I'm focused on at the moment. You have adult and pediatric medicine, which is where they offer 3 years of basic training and then 3 years of advanced training. After the basic training, you do have exams. And then once you have passed that, you go into the advanced training of your choice. And I'll show you a little picture of what the advanced trainings are, options are. Total of 6 years. Currently, they have changed the rule that you don't need a PR or a citizenship for that sort of specialized training. All right. ED, you do need a citizenship or a PR. So along with the exams, you do have to check on your residency status as well. All right. Now, for ED, they do expect you to be a postgraduate level of 3 and higher, and that you have done 6 months of ED after postgraduate level of 2, and also 6 months of ED in the last 1 year phase. And again, it's 3 years of primaries, which is your basic training, and then 3 years of advanced training. And you can focus in anything you need: education, ultrasounds, trauma, peds, anything you like. And then you have surgery. Now, surgery and general practice vary a little bit. Surgery and general practice, you do have an entrance exam to get in first, which is for surgery, it's called the SET exams, where you have to fulfill the eligibility criteria to sit the exam. And even for general practice, where you do have an entrance exam. For general practice, which I'm going to dissect a little bit more, you have the MCQs and the interview stage once you pass the MCQ exam. The general practice is basically family medicine, and it is a 3-year training program, and 1 year is done in the hospital, and the 2 years are done in your GP facility of choice. All right. Again, you need a PR citizenship. You need to fulfill the criteria. There's 3 colleges that do the general practice. The only catch for international medical graduates is that you will be subjected to a 10-year moratorium. That means you're subjected to work 10 years in a rural area unless you are provided with an exemption. Okay. Now, I know 10 years sounds very long, but let me give you an example. So I'm a PGY 5 at the moment. So what happens to my 10-year program is that I only have 5 more years left. Even though I haven't done 5 years in GP land, I've done 5 years in the hospital. So they do count my 5 years that I've done in the hospital. So at the end of the day, I only have 5 more years to go. So there is a bit of a bonus to that. But some of you might like the rural. So some areas are quite nice. The pay is much higher and it's a much more calmer life. And a lot of people do tend to enjoy it. And so that's just the overview of specialization. Now, these are all the specialties in pediatrics and in adult medicine that is offered to you guys. So it's just a small snapshot of what's out there. As you can see, you enter, you finish your basic training, either adult or pediatrics, and then you can enter any of the advanced training of your choice. Moving on, let's talk about salaries because you need an income to live here and it is quite expensive. So JMO is a junior medical officer, and those are doctors that are considered as interns or resident medical officers in other terms. So the salaries vary from state to state, and I've given you a bit of a snapshot as how they vary, and it's more or less same even now. So as you can see, Western Australia is the highest paid, which is about 85 to 86 per annum, and this is pre-tax. And then you have Tasmania, which is the other end of the spectrum, which is 72 again per annum pre-tax. New South Wales, South Australia, Victoria, they're all pretty much similar, and they're in the middle category. Now, this is your base salary without any overtime, on-call rates, public holiday rates, and weekend rates. Okay, so those are all the extra amount that's going to add up onto your salary. And if you do a night shift, that's again added on. Okay, so for example, public holiday, you have 2.5 times your base salary rate. So it does add on quite a bit. Now, it's really, and top, now before we go on, let's talk about the consultants. So once you've got your fellowship, top level consultants can earn up to 400,000 AUD per annum, again, pre-tax. GPs, they tend to vary because it depends on how much or what facilities you have in your practice. So for example, a GP that does Mirena insertions, that does prenatal screening, that does, manages elderly patients, does mental health plans, care plans, they will be at a much higher rate as compared to a practice that doesn't do any of that. So they can range from 150 to all the way up to 300 to 350 as their salary. And again, specialists, they vary, public and private vary. Public, you will be given a standard salary that will be paid to you. And again, it again goes up as you become more senior in your position. And even as a JMO, as you get more senior in your positions, for example, PGY 4 and 5 are much higher than a PGY 3 and 2. As you get senior, your salary does go up as well. So in public, specialists will be given a standard salary, and that tends to go up, and they'll be paid for the public holidays and all of that. In private, however, you will be a contractor. So what happens is that if you don't see a patient, you just don't get paid, and you don't get any of the other bonuses either. Now, That being said, I do have friends and doctors that do both public and private, 3 days in private, 2 days in public, and vice versa. Okay, so that is an option. Now, so this is again a very brief overview of how it is paid. Again, varies from state to state. As you can see, the neurosurgeons earn the most, and this is a graph from the Business Insider. As you can see, as it goes down, the scale goes down. Now, it's well and good that to earn a lot of money, but again, we get taxed on most of the stuff. So the more you earn, the more you're going to be taxed, and that's how it is here. So as you can see, if you earn less, like up to 18,000, you pretty much don't get taxed. But once you cross the 180 mark, you're going to be taxed up to 45% of your income. All right. Now, there are ways out of this, so we'll talk about that just now. So what is salary packaging? Now, this is something that I did not know till like about 2 years till my husband was like, hey, my friends actually told me, hey, did you know there was something like this in your hospital? So basically, it is a way to minimize the amount you're taxed. Your gross income is taxed. It allows, so basically what happens is that you earn a certain amount of money, which is your gross income, and 30% of that is taken away and put into a third-party account. So that reduces your taxable income and basically increases your discretionary spending. So the final amount that you tax is much smaller than what you actually earned. Now, the amount that was separated, you get to actually spend it, and it'll be given as a credit card, and you can actually spend it on grocery items, eating out with friends and family, and you can even apply it for car loans and home loans and things like that. So it does go a long way. So this is one way of getting around the taxes. I mean, helping you with the taxes a little bit. Now, what is superannuation? So superannuation is basically your pension. So it's basically your employer putting a certain percentage of your income into your pension scheme. So I put a picture of Hesta. Hesta is one of the companies. It's the company that I'm linked with. So as you can see, they're a third party, again, company that I put my superannuation funds into. Usually they take about 10.5% of your income and they put it into that. All right. And you can tap into your pension if you feel like you're low on your funds and you need it for something urgent. All right. They are looking at increasing it to 12% by 2025. So the only other thing that I want to kind of point out is that when you change hospitals or change states and change hospitals, you make sure that you also take that funds along with you. Okay. So a lot of people forget about the superannuation and leave that fund in that one particular spot. You have to take it along with you. So now let's talk about medical indemnity. That's something, again, I did not know till I started working in the system. So basically, this is just medical insurance. And they cover you both legally, and they also cover any costs that you have to pay if you are found to be in harm or committing an error or negligence or any other omission. So this is another area that your money is going to go into, and this is what you're going to be paying. Now, if you're in a public sector, the hospital does have a medical indemnity for you. But however, my advice to you guys would be to take a separate third-party indemnity, because at the end of the day, the hospital is more favorable to the hospital rather than the doctors. So if you're ever in trouble, you need a third party to come and take you out of that situation. I'm particularly with MIMS, and MIMS, now these guys are really good also in the sense that they do release videos. So in case you need any advice, and for example, I was called as an expert witness for one of the cases. I did not know how to present myself as an expert witness. All I had to do was call my indemnity insurer and ask, what should I do? And they will tell me all the facts, what all I can claim, what all money I can claim, and how I should present myself and what I should say in the court. So that way they do kind of assist you and help you in medically and to help professionally and help you adjust into the system. All right, time for FAQ. So these are a couple of questions that I've come across, and a lot of you guys have been pinging me over the week. So I thought I'd put it all in my presentation so it helps everyone. So why do people fail the MCQs? I'm pretty sure a lot of you guys have checked the statistics of the MCQ pass rate. MCQ pass rate is about 45 to 50%. Again, all on recalls. The reason the other 50% or the other 65% fail is because follow American guidelines. They practice or they answer questions as how they would practice from their home country, or they're just completely unfamiliar with the recalls. And that is not okay, because that's 80% of your questions. Why do people fail the clinical exam? As you guys know, the pass rate for clinical exam is about 20 to 22%. That's mainly because, well, a lot of us come from various backgrounds and we speak multiple languages. I speak about 6 languages. So it is very hard to kind of switch languages. But however, and we also do not counsel our patients, and that is very important. So communication is where a lot of us kind of get stuck. And I know this personally because I do teach a lot of you guys. A lot of my, I do end up teaching a lot of people. So this is where a lot of people don't know how to counsel a patient, and also has a detailed history and a short history, concise history in that 8 minutes for that each station when you do appear for the exam. Organization, knowing your basics. I know this is tough, especially for specialists who have gone and done super specialities. Coming back to basics is really tough. So, and memorizing and going doesn't really help either. So that's one of the areas that people struggle. And familiarity with the Australian guidelines. Again, up to date, Medscape, American Family Physicians, all of these guidelines don't help. You have to go through Australian guidelines. I have made a video for the MCQ and the clinical exam as to what guidelines and what books and what references to refer to on my YouTube channel. So if you guys are ever looking for answers for that, it is up there. And it's also on my Facebook group in a PowerPoint. So are the exams tough? Well, yes and no, because one, remember I talked about the limited registration? A lot of us end up working. So once we start working, we work about 8 to 10 hours a day. Then we come back to our family. We work about 5 days in a week, and then you have the weekend left. And during that weekend time, you have to actually study. How many of us are actually going to end up studying? So that's where a lot of us get stuck, and a lot of us don't do the practice. A lot of us don't study, and we end up going to the exam unprepared completely. The other ones, yes, it is also the no part is because it is at the end of the day, not the MCQs, but the clinical is a very subjective exam. So it is as the examiner perceives it. So therefore, there has been issues, and that's where your communication skills come into place. Is there a limit on the number of times I can sit for the AMC MCQs or the clinicals? No, there's no limit. You can sit how many ever times you like. Is there a difference between the AMC and the AHPRA? Yes. So AMC is an independent national board that oversees all medical education and training, as AHPRA only deals with your registration. They also regulate 14 other disciplines, so like psychology, occupational therapy, nursing. So they're not just medicine. They actually deal with multiple other disciplines as well. So they only deal with your registration. What happens if I have a gap in practice? So this is only applicable to candidates that have completed the internship and there's a bit of a break, gone married, had a child, has a bit of break. And if that break extends more than 2 years, then you need to complete about 4 weeks in one registration time to close the gap in your country that you hold registration with, or you have to complete 12 weeks of full-time work over 3 years. That's 3 consecutive registration periods. All right. And again, this is not applicable to recent graduates and not applicable to graduates that are not considering to practice clinically. Can clinical exams be taken in our own home country? No. Face-to-face, and it's usually held in Melbourne. Where else can I work with an Australian recognized registration? Well, you can work in Ireland, New Zealand, UAE, and India. And to a certain extent, you can work in Canada, Hong Kong, and Singapore, but there are limitations. So you'll have to check up on that if you are planning to travel and relocate. Who should apply for internship? Well, so this is an interesting question. So candidates who haven't completed the internship from their home country, I know there's a huge population from Malaysia, and I know that there's a couple of people from India and a couple from here as well. There's a new school that that is linked with Samoa, with Samoa. So all of you guys who haven't completed internship must do, once you've completed your clinical exam, you have to apply for the internship role, not for the resident medical officer role. And what about the candidates who have completed the internship? Can they apply for the internship role? Absolutely, you can. If you guys are okay to get into the medical system and put your foot in through internship, absolutely, go for it. The only thing is that you guys are competing with local grads that have completed the medical education and require the internship role as well. So you will be competing with local grads. What are some IMG friendly specialties? That's a tricky question because it depends on how committed and how much you want that particular specialty. So for example, obstetrics and gynecology and surgery are quite tough. It's very competitive. You need to have multiple publications, and you're competing with the local grads here who also do a PhD and a master's to enter these programs. So you are looking into doing a master's in public health, a PhD degree, and a couple of studies as well. If you guys are happy to put in the effort, absolutely. The other ones are the more friendly ones at GP. You do see a lot of IMGs going into GP field because it's short. You guys all come in a later phase of life compared to the local grads. And the other one is ED as well, because it's, again, if you're working full time, you're working 4 shifts in a week, which leaves you with about another 3 days off where you can be with your kids. So ED is another one where the eligibility criteria is a bit easier if you have your PR or citizenship. And the other one is BPT training. Again, BPT, certain specialties are easier. So for example, geriatrics is a very popular one that a lot of people go for. Palliative care is a one that a lot of people go for. So those can be competitive, such as nephrology as well, and endocrinology. But a couple of other ones, such as general medicine, are a bit more easier to get in. That's why. So it depends on how many publications and how much of work experience you have from a country as well also matters. Does MD or MS count? Does MRCS or MRCP count? The MRCS though can count for your set program there is a particular pathway. If you're more keen on that, you can send me a message and I will send you the link to read up on that. Can I know a bit more about the specialist pathway? Absolutely. So specialist pathway has two avenues. One is the specialist recognition and one is the area of need. So specialist recognition is where you basically apply directly to the college of your interest. So if you're going for medicine, you have to apply to the RACP, which is the Royal College of Physicians. You apply directly, they assess your work experience and your education and all the training that you've gotten. And once that is done, what they will do is you'll have to go under a period of supervised practice. And it's usually about 6 months. And this will include a work-based assessment, and you might even be asked to take an exam. Once that is done, they will categorize you and see if you guys are equivalent to the Australian training. And I'll show you a flow chart about that. Now, there's another one, which is called the area of need. Now, this is determined by again by the relevant state or the territory, the health authority. Okay, so it is not AHPRA or AMC that decides if it's the area of need. It is actually the state itself. And basically, if they deem that your specialty, that they're short of doctors in that particular specialty and they need that specialty in that area currently, you can apply through this pathway. They'll again recognize it, but again, a big thing is that this does not mean that you will be getting a specialist registration through this path, through the area of need pathway. So once you've gone into the area of need pathway, you should apply for the specialist recognition pathway as well to get a specialist registration. I hope that's very clear for all you guys that are looking into the specialist pathway. Okay. Now, for basic physicians, I've also uploaded a video on YouTube to tell you a bit more about the specialist pathways that are available for you guys. So this is the flow chart that I was talking to about. So you apply for the specialist pathway, you again get your AMC, apply for the AMC, get your college recognized in the World Directory book, the World Directory of medical schools, and then apply for the relevant college for the specialist recognition. Once that is done, if they deem you as not comparable, then you have to go through the competent or the standard pathway, which I discussed earlier. But if they deem you as partially substantially comparable, then you have to get a job offer, and that is all on you. You have to actually apply for the job on your own. Once that is done, you apply for the provisional registration. The college will complete, then you complete the requirements of the college. And if you've satisfied all the college requirements, you'll be awarded a fellowship, and then you'll be awarded a specialist registration. You can work as a specialist here. I hope that flowchart kind of summarizes it very well for you guys. All right. If you have any further queries, don't hesitate to get in touch with me. You can get in touch with me through my group. That is the best way to get in touch and post the questions there. I'm also on Instagram for any queries, and my LinkedIn account as well. I'm also releasing 3 books as of October 9th for a clinical exam preparation. So if you have any queries, do get in touch, and I'm more than happy to help you. And I'll take some Q&As now. I hope it wasn't too lengthy.
Thank you so much, Dr. Balan, and thank you so much to all the doctors who are attending this session. And yes, as Dr. Balan said, we can. I see that there is a lot of Q&As which is there. There are around 77 questions, and I don't think so Dr. Balan will be able to answer all those Q&As, but definitely Dr. Balan, if you could select at least around like 10 to 15 ones, and the rest Q&As will be definitely answered in our community page, which is the inspiremg.com, and the registration link for the community is also being put across in the chat box right now. So Dr. Balan, we can move to the Q&A right now.
Sure. So I think I've answered couple of answers here. So I passed AMC 1 and PLAB 1, and I don't have an Australian visa. Which option best suits me to grab a job in Australia eventually? PLAB AMC 2 or PLAB 2? Very good question. Well, the two different, well, it depends. First and foremost, my advice would be to kind of decide on a specialty. So if you're going for surgery, which is a very long haul and a much tougher pathway to do AMC first and then trying to get into the surgical program here, if it's surgery that you're interested in, I would suggest you to stay in UK, do the PLAB 2, which is a bit more easier, and go for work in UK and get your degree, do the MRCS and do the FRCS there. Once you've done that, then it's easier to move here with the specialist through the competent pathway or through the specialist pathway to work here as a surgeon. So it depends on the specialty of choice. So choose your specialty first. If it's, again, physicians or whatever, more IMG friendly, you come here. A lot of people also choose Australia versus UK, depending on where they want to live as well. So it's based on what kind of country you want to live, basically. So the other question, I hope that answers your question. And if you have any more, if you have any more doubts, don't hesitate to hit me up. The other one is, I'm planning AMC Part 1 next year. I've talked a bit about the specialist pathway, so I'm going to skip that. And if you have queries again, you can hit me up. I'm giving my PLAB 2 this year. I'm planning to work for 1 year in the UK, later planning to pursue my residency in Australia. Do you think it's a good idea or any suggestions? We have a lot of candidates that do that. Yeah, absolutely. So what happens is basically you can come to the competent pathway, work here, and if you don't like it, it's easy to go back to UK. So it works both ways. Yeah. And it's easier if you've done the UK pathway. Okay. Can I join Australia as a surgeon after completing core training in UK? Will I have any advantage, or will it be the same surgical pathway? And what about becoming a surgical consultant in UK? My advice, because it's surgery, complete your FRCS in UK and then come to Australia. I hope that answers it. It's similar to the question I answered earlier. You can do your internship in Australia, but again, you're competing with the local graduates.
And also, Doctor, I see a common question that we always get. So, what about the IMG acceptance rate in different branches in Australia after clearing the examinations and getting into the pathway?
So there is no, so basically the IMG acceptance, as you can see, like you'll notice that a particular department, for example, let's take medicine, for example, medicine versus surgery, you'll find a lot more, you will find Indian doctors in surgery, but they're all UK trained because that is the easiest pathway. And again, then you will see medicine, and in medicine you'll see that there are certain branches that will be mainly mainly IMGs versus the local grads, and that is because of the eligibility criteria, because candidates here have been training. So for example, cardiology versus general medicine. Cardiologists, most of the graduates here have done 2 to 3 publications plus a PhD and a master's on top of a medical degree. Most of our IMGs have not done that. So that's why the acceptance is not as high in cardiology versus general medicine. It is nothing due to where we did our medicine. It is only because of the experiences and the titles that we have gathered in our name, basically.
Thanks so much, Doctor. So another question is that how difficult is to get the PR / the citizenship? So
well, once you get the PR, the citizenship is pretty straightforward. You just have to fulfill the criteria of number of years in Australia. The PR, but however, to get the PR is tough. The point system has gone up. I have had a couple of friends that have had to do that. So I think for doctors, you need about 90 to 95. But again, once you come here on a working visa and you have a job in place, your points are quite high already. So to apply for a PR should not be tough. But the only other thing is that waiting for the PR is what kind of makes it tough for you guys, because when you wait for the PR takes about 12 to 18 months to come through. So that means for that 12 to 18 months, you can't join any specialty if you have gotten your general registration and you fulfill the criteria.
okay, Doctor. And here is there another question. So if you don't mind, would you just give a small glimpse about what your timeline exactly was like? How was it for you once you were done with your MBBS in India? So how long it took for you to
absolutely. Yeah. Before I get into that, just because I saw a couple of specialist questions, guys, I just for one thing I want to touch base for the specialists out there is that I talked about the specialist pathway and about getting your experience in your work accredited with the specific college. I have had a lot of surgeons, doctors, my own professors, my colleagues that have come to a specialist pathway, but at the end of the day, they have had to do the AMC exams. And once that they cleared it, they became the specialist. So please bear in mind, part of relocating, you will most likely will be subjected to taking the AMC exams. Okay. Now back to the question. My pathway. So I finished medicine and my internship. As soon as I finished, I took a year off. I decided to get married. And then I decided to prepare for my exams. I did 6 months of preparation. I definitely recommend study partner because it's boring to go back to the basics. And then took 6 months, gave my MCQs, passed my MCQs. Then I took again a month break because I was burnt out from all the study. And when I say studying, my MCQs, I used to study about 8 hours a day. So I was very focused, and that's why and 6 months was a stretch. I think it was about 5 months that I kind of finished it. So 8 hours a day, and I knew every single question possible. Okay. And I did score very well. And that did help me get my job very quickly as well, because when I was in the top 5%. So that made me get my job quite right away. Then after that, I did about 4 to 5 months of clinical prep. I had 2 study partners, and I did again 8 hours a day, and I passed mine in my first shot. And after that, now during when I started, there was no job offers, even if you finished your clinical exams. But then again, because of my MCQ score, and again, like like your alumni association and things do go a long way, your referees go a long way. And yeah, I joined as an observer and I started work in 2 months' time.
That's that. Thank you so much. I mean, the answer was a little short, but I definitely understand the, the time it took and the hardships. It's really great, doctor.
Well,
So
I mean, uh, yeah, was there anything else you were looking for?
no, that's fine. That's fine. Okay, and also to all the doctors who are attending the session, I see that there is a lot of questions here, and due to time constraints that we have, we won't be able to answer all these questions. But definitely, we will be putting up all these questions in our community, which is the Inspire IMG community, and the answers to these questions will be also be put up there. So the just to sum up the whole session, and as a final question, I can see a question here, Dr. Balan. Um, so the doctor has asked, if are you really satisfied working as an IMG doctor in Australia with your professional and social life? Is the struggle struggle and wait worth it? And if for a doctor who is planning for AMC, what will be your feedback, or what would you be having to say to them?
Very good question. Uh, no, a bit about my background that I did leave out was that I was when I was studying in medicine, I did work in Australia for 1 month. I did get into an exchange program and I worked in Australia for 1 month. Now I've also worked in other countries. I've worked in Saudi Arabia, I've worked in India, I've worked in Australia, and I kind of know how each country. I did have a very good picture of how each country worked. And as for the struggles, once you cross that general registration and once you get the job, yeah, I'm very satisfied. My work hours, the social work to life balance, like currently, because of the work hours, and I'm able to have a full-time emergency medicine job, and I'm also have my own company, which I teach, and I'm publishing books. And at the same time, I also have a family where I have a puppy and a baby where I'm able to spend my time with the family. So yes, definitely worth the struggle, but it is an expensive struggle though. So that is why I see a lot of candidates saying UK, PLAB versus AMC, PLAB versus AMC, and then there's a lot about Indian exams versus AMC. Again, AMC and I think the Canadian exams are one of the most expensive exams. So you guys have to be absolutely sure and set in your path and no turning back if you guys are going to do the AMC exam. That's my one advice to you. And once you've crossed that, yes, absolutely. Even the Irish doctors, they fly over here just to get a bit of a break and have fun and learn medicine and then go back. So yes, definitely. My answer is definitely yes. And I do see like one of the candidates here asking, how long does it take to get into the residency program? So in India, you get picked on NEET PG ranks. How do we get after AMC 2? It's your choice. So that's the other beauty of working in Australia. You get to choose. You just have to satisfy the eligibility criteria. And if you're motivated enough to compete with the local grads and other international medical graduates, you could do whatever you'd like.
Okay, doctor. Thank you so much. Thank you so much.
You're
So once again, I thank you for taking out your time, and I'm definitely sure that the session has definitely helped out many doctors who have joined the session today, and really even we also found this really helpful. And I also thank all the doctors who have taken their time to join this session, and and it's really exciting for us also to see a lot of people being excited about exploring about various pathways and various options for doing their medical PG. So once again, thank you all for joining the session, and Dr. KP, thank you so much for your time.
No, thank you so much for having me and for creating this wonderful platform. I struggled with it when I first started, and thank you for creating this. Thank
Sure,
you for
doctor.
having
Thank you. Looking forward. Bye.
me. Bye.